Bulavanaka, Fiji. Welcome to Speak Your Mind on Gold FM and FBC TV. I'm Rita Naran, and today we're talking about volatile substances abuse and a draft decree that is aimed at controlling this, as well as protecting children from the harm of this type of abuse. And in studio with me today, Mr. Misele Njumbalavu, Director of the National Substance Abuse Advisory Council, and Dr. Nirvana Karan of the St. Giles Hospital here in studio to talk about this issue and as well as this draft decree. Now, firstly, welcome to this program, Mr. Njumbalavu and Dr. Karan. If we could begin with talking about the National Substance Abuse Advisory Council, what is the role of this council? Why was it established?
Thank you, Rita. Just to go back in the history of this organization, it is a statutory body under the Ministry of Education, and it was established through an Act of Parliament called the Substance Abuse Advisory Council Act of 1998, and the office of the Secretariat of the Council came into being in 1999. Now, at that point in time, the Cabinet decided one of the key policy objectives of the establishment of this council was to promote healthy living in relation to responsible drinking, because it was evident way back then there was this increase in drugs and substance abuse, particularly alcohol. Therefore, that was one of the reasons for the establishment of the council, for the council to work collaboratively with non-government organizations, civil society organizations, faith-based organizations, to address issues relating to drug and substance abuse. So in the council, we have representatives from the Fiji Council of Social Services, the Fiji Council of Churches, various government ministries, for example, the Ministry of Health, the Provincial Development, Ministry of Finance, and of course the Ministry of Education.
Mm-hmm. Now, can you talk about some of the work that the council has done in recent past years?
Thank you, Rita. In terms of the roles of the council, I can mention three very briefly. One is in relation to education and training, and that involves the education and training of teachers, students, and the general public for them to become aware of the dangers or the harmful effects of drugs and substance abuse. There's also a role that we play in terms of research. We have conducted a number of researches in schools in the last 5-6 years. One was conducted way back in 2004 and repeated in 2010. That was in secondary schools. There was another one conducted in primary schools in 2005 and repeated in 2011 for that enable us to gather actual evidences or data on the prevalences of drug and substance abuse among students in our schools. And thirdly is this issue about dissemination of information. We are very grateful to FBC and other media organizations allowing us to disseminate information to the public, particularly to parents and the children, relating to the harmful effects of drugs and substance abuse. And this involves working with the media, printing of materials, etc., etc.
Okay, thank you, Mr. Njumbalavu. Just for this benefit of our listeners, if you have any questions, either for the Mr. Njumbalavu or Dr. Nirvana Karan, you can email your questions to goldfm@fbc.com.fj. We're also on Facebook on Gold FM Fiji, and you can also call us on 3220-906 or 3220-907 with your questions. Now, Mr. Njumbalavu, can you talk a little bit about some of the findings of these studies that were carried out that you mentioned?
Yeah, from our research that we conducted way back in 2004 for secondary schools and again repeated in 2010 and also for the primary schools, it was becoming clear to us and then to the Ministry of Education that there's been a trend of increase in drugs and substance abuse amongst our children. And it was in the last few years. And then we correlate this research work and the findings with our SIMS information, that is the School Management Information System, relating to the number of cases reported to school heads all over the country and collated by the Ministry of Education Statistics section of the Ministry of Education. So it is becoming clear to us that this issue is increasing. And the latest figure that we had was in 2011, and that was quite disturbing to us, where about 60% of our secondary schools throughout the nation had recorded drugs and substance abuse. So our main concern is in the secondary schools. When we compare this to the primary schools, the percentage is reversed. That is only about, over 60% of the primary schools were drug-free. In other words, they did not have any record of drugs and substance abuse.
Mm-hmm. And when you're talking about drug and substance abuse, what are some of the substances, or what are some of the drugs that were highlighted?
Yes, thank you, Rita. The most common drugs and substances that have been abused by students, of course, include alcohol, marijuana, of course, but we have noted a decrease in the trends in marijuana use. Kava is something that we have seen recently, quite disturbing. The percentage use of kava or abuse by students is quite disturbing. And then we have these inhalants or solvents, which includes such things as benzene and glue. These are the kinds of substances that are abused by students. And of course, cigarettes. We are very grateful to the Ministry of Health for the work that they are doing in terms of the tobacco control decree, controlling the use and, of course, the supply of cigarettes by our young people.
Mm-hmm. And were there any sort of particular trends that were identified in these studies? Are they confined to schools, urban areas, or is this right across? I mean, your studies, what areas did it cover?
One may question our study because our interest when we conducted our study then was to focus on the schools that had recorded high number of cases of drug and substance abuse that was actually reported in the school confidential files. So when we analyzed these files, they're called the red files, it showed that about 29 secondary schools in the country had the highest number of offenses. So our study, the research field study that we conducted, was actually just focusing on these 29 schools to have a comparative analysis on what was reported in the confidential files and what is actually taking place in the on the ground.
On the ground. Okay, thank you, Mr. Njumalavu. We'll take a short break and we will resume with discussions in a moment. Welcome back to Speak Your Mind on Gold FM and FBC TV. I'm Rita Naran, and in studio with me are Mr. Misele Njumbalavu, Director of the National Substance Abuse Advisory Council, and Dr. Nirvana Karan of St. Giles Hospital, and we're talking about volatile substances abuse. Now, before we went to the break, Mr. Njumbalavu, you mentioned that there were a couple of studies that were done, and one of the sort of newer trends that's come out and is being highlighted quite a bit in the media now is the use of volatile substances such as inhalants and things like that. Can you talk about this? What is the scenario right now on the ground?
Yes, thank you, Rita. From the analysis of the School Management Information System of 2011, we have noted that the high prevalence of the use of glue. There are two types of glue that are coming up: PVC glue and Dunlop glue, and the other one is benzene, and also paint thinner is coming up in the from the research and also from the SIMS. So those are three that I can recall that are the ones that are mostly abused by students, but there could be others which we have not detected because there are a lot of experimentation taking place. Yes.
Mm-hmm. Now, That's interesting, the substances that you mentioned, because these are readily available. You can, pick them off the shelves in supermarkets and shops. So what is being done to address this with your other partners?
Thank you, Rita. Way back in 2009 and early 2010, after from the results of the research that we conducted, we conducted consultations with various stakeholders, including the St. Giles Hospital, the Juvenile Bureau of the Police Department, Ministry of Health, and other stakeholders, including Save the Children, UNICEF. And there was a great concern on the statistics that was revealed at that point in time. So we worked on making a proposal for a legislation to be put in place, and we conducted some research from other jurisdictions overseas, and we found out that in Northern Territory of Australia, as well in Western Australia, they have a legislation particularly focusing on volatile substance abuse, because when we look at the crimes decree or the penal code that was in the past, there is no provision to control the sales of these substances, because they are legal substances allowed by law to be sold. But because of the concern of the various stakeholders in terms of the health of the children, we thought that we should go ahead with the proposal to government for the adoption of a legislation that would enable the government to control the sales of these legal but volatile substances.
Okay. Thank you, Mr. Ndrumalava. Before we perhaps carry on with discussions on the draft decree itself, maybe I could pose this question to Dr. Curran. Why are these substances, I mean, these are things that we use almost every day. How can they be so potentially dangerous and fatal?
Well, I think some of these substances, because we've just grown up with it, then we don't look at it as a substance to be abused. But lately, there's a trend in the younger people, and as people are becoming more aware that these substances can be abused and you can get intoxicated with it. And because of this more awareness, I think people are more susceptible to using things, and they don't realize that these things are dangerous as well. That you're not only getting intoxicated, you're also having some short-term and long-term effects of these substances, which can be quite dangerous to this group of people who abuse them.
Mm-hmm. And what kind of effects are we talking about?
Generally, it depends on what you are inhaling or using to intoxicate yourself. But some of them, like if you're using fumes and other stuff, then you've got respiratory problems that can develop in things. And if you're intoxicating yourself with these substances, then you also have long-term brain damage in some people. And some susceptible individuals, after abusing these substances, can also develop mental illnesses. And these things are quite serious, and they have different consequences and treatments and management.
Okay, thank you, Dr. Curran. Now, Mr. Ndrumalava, going back to the issue of the draft decree. Now, you did mention that there is legislation being put together, and you have this draft decree. Let's talk about some of the provisions of this decree. What do they address?
Thank you, Rita. I think part 2 of the decree is related to the prohibition of sale of these volatile substances. This section talks about the fact that the volatile substances, which we will, after the consultation, we'll have a final list of the substances that we would be putting under control. That section, this part 2, prohibits the sale, in other words, of these substances to children. And that we want to emphasize, to children under the age of 18. And there's a provision there, if a shopkeeper of anyone is caught selling these substances for the purpose of intoxication to children, that person can be fined a sum of $5,000 or imprisonment for 2 years. Mm-hmm. So that's one on the prohibition of sale. There's another section which relates to counseling, and maybe Dr. Karen can talk about that also. But for very serious cases, and if the person refuses the voluntary counseling, then the court can make a decision for that person or that young person to go through compulsory counseling. And that is where we will need to take that young person to a counselor who is going to be recommended by the court for compulsory counseling. Of course, there's another section which deals with the police powers on the search and seizure of these substances. Will provide the powers to the police, because as you understand, Rita, currently the police are powerless to arrest anyone found selling these substances to children. And we have received cases of people from school teachers where these substances have been trafficked and taken to students in schools. So that provision in the decree that prohibits the sale of these substances to students will empower the police to take to task these people who are doing this job.
Okay, thank you. We'll take a short break and we'll be back in a moment. Welcome back to Speak Your Mind on Gold FM. I'm Rita Narayan, and we have in studio Mr. Misele Njumbalavu, Director of the National Substance Abuse Advisory Council, and Dr. Nirvana Karan from the St. Giles Hospital, and we're talking about volatile substances abuse and a draft decree that is aimed at controlling this as well as protecting children from the harm of this type of abuse. And if you have any questions for either of our guests, you can email us the questions on goldfm@fbc.com.fj or call us on 3220906 or 3220907. Mr. Njumbalavu, before we went to the break, you were talking about some of the provisions within this draft decree, and I was stressed that this is still in its draft form. You mentioned that the powers that the police have to go after offenders, either who sell these or traffic them. Now, what are some of the penalties? Does the draft look at this for offenders or convicted?
Yeah, thank you, Rita. The penalty is that anyone who is proven to have been selling these substances that we are going to look at and provide a list of the volatile substances that will come under the control of this decree can be taken to task by the police, and the fine that we are proposing is $5,000. That we are putting Rita as a deterrent to people who might be doing this selling, and also for imprisonment for 2 years. So those are the penalties that is provided for in the decree. And also for anyone selling from a home or from a shop or any building, it's also provided for in the decree. The same penalty will apply. That particular person who owns that property or that house will be fined $5,000 or put into prison for 2 years.
Mm-hmm. Now, your partners in this in the business community are the Fiji Retailers Association?
Yeah, thank you, Rita. I'm very pleased to have gone and talked to the president of the Fiji Retailers Association, who has given his wholehearted support to the implementation of this decree, and is very much concerned on the lives of our young people, the future leaders of tomorrow. So he has given us his full support, and we have, through the emails that we have exchanged, he has already contacted his members throughout Fiji, the various branches of the Fiji Retailers Association, and we have again, just last week, sent him further information about consultations that we are going to do throughout the main urban centers in Fiji.
Okay. Now, do we have a number of the items on this prohibited list, or is this still work in progress?
I think it'd be fair to say that we're still working on the list of substances we'll be putting out and for the general public to comment on. We have about 18 in the list currently, but that probably will be reduced depending on the on the opinion and the comments that the general public feels about these substances. But when we look back, there are these substances are being abused. Some of these substances are being abused by students, and that has come out in terms of our research. But we will need to consult widely and hear the views of the public, the parents, the teachers, and all those concerned with the lives of young people.
Thank you. Now, Dr. Curran, if we could talk about the provisions of counselling and the compulsory counselling order within this draft decree, what is the process where you come in?
I think at the moment what we're trying to do is bring up a list of these counsellors and where these counselling services are going to be provided. And we're having discussions, and so that when the court says you need to go for compulsory counselling, where do you go? Who's the people who are going to be doing it? And how long this is going to be done for? So we're still having discussions around that and coming up with a list of counsellors who the court will be able to use.
Okay, so that's still, you said, in discussions at the moment?
We're still in discussions.
Okay. Now, what about in terms of the protective custody? If a child shows up, if there's a case reported and there's directions for the child to be kept in protective custody, where is there a safe home? Where would the child be kept? Is that maybe Mr.
That again, Rita, is an issue that we still need to consult with other government departments, because unlike in overseas, they have these facilities provided for the safe place, rehabilitation center, things like that. But here in Fiji, we do not have those kinds of facilities yet. So we'll have to talk with other relevant government departments on how we can address this issue. But I'm sure we can deal with those issues when we come through to it. Yeah.
I think the important thing is that in the this draft decree, they've mentioned an alcohol and drug abuse rehab center and things like that. And once this goes into once this becomes law, then I think these things will have to be provided for. So it won't be about setting up a center. A center has to be provided for these sort of situations in case. And I think that's what's going to be the good thing about this decree is that once it gets legalized and passed as a law, then these provisions will have to be catered for.
Mm-hmm. Right. Now, what about in terms of parents who bring their children, or because you have St. Giles Hospital, them showing up at the hospital, and there's the whole still that stigma surrounding St. Giles. Can you talk about that?
Well, we do have a lot of stigma about St. Giles, so people are still very hesitant to come and seek for help. But then on the other hand, I think they're not aware that there are other centres as well where you can get help from. And so in terms of substance abuse and volatile substances especially, you have counselling services available in most centres around the country. And Empower Pacific is a really good service, counselling service provider, which is available free of charge. Their Ministry of Health has contracted them to provide counselling services throughout the country. And so it's a walk-in service. People can go into the service and get some help as well. So they don't necessarily have to come to St. Giles all the time. So there's provisions available, but I think people don't use them, and that's the issue in how we're going to raise more awareness so that people are using these services, free services.
Okay. Speaking about awareness, Dr. Curran, perhaps we could just talk a little bit about some of the initial signs that people can pick up, either parents or guardians or responsible adults around these children. What are some of the signs that they can look out for?
I think For most of the time, it's the caregiver, which is either the parents, or in Fiji, you have the extended family that's looking after a child. If you start noticing changes in their behavior, especially a decline in their school performances, or they're becoming more truant, or the attendance is not up to date. If you notice these changes, I think you need to look into it more. You need to be a responsible caregiver and discuss this with your child, or find out with the school what's happening. Why is the performance all of a sudden going down when this child was performing so well or doing good in school? Or why is this child not going to school every day? So where is this child going? These are some of the little signs that are that will be present throughout. And then, of course, if the child has become addicted to these things, or has used them too often, then you've got the medical complications that start showing, which is you'll have respiratory problem, physical health problems. And then you can also have mental health problems. And by that time it goes to this stage, I think the caregiver should recognize these early things about school performance and attendance, and that should raise a red flag for them.
Okay, thank you very much. We'll take a short break. Welcome back to Speak Your Mind on Gold FM. I'm Rita Narayan, and this program is also being recorded for FBC TV. Now, Mr. Njumbalavu, we were talking about some of the provisions of the decree. Now, at what stage are we now? This is a draft, and you'll be having public consultations?
Thank you, Rita. This is actually the 7th draft of the decree, and we are going to take it out for the public to provide their inputs, their comments, their views, and we have given out some notices, some media awareness. Already we thank FBC for this role, and other media organizations, because the role of the media is so crucial in any kind of this work. So some awareness have been carried out since last week and up to now, and we are going to go out into public consultations from the 1st of August, beginning in Lambasa, and then it will go down to Sabsabu, then to Taveuni, and then we'll cover most of the urban centers in Vitilevu, and the last consultation will be held on the 29th of August, that is in Levuka. So we are really calling for members of the public, members of the Fiji Retailers Association, parents, etc., to come in numbers and give in their submissions, or come during the public consultation, air their views, and inputs into this draft decree.
Mm-hmm. And what sort of response are you expecting? What would you like people to come and discuss during these consultations concerning this draft decree?
Yes, Rita, we will be conducting a presentation to all the centers that we will be hosting this consultation in. And we would like parents, whatever their views on any of the matters in terms of the prohibition of the sale, the penalties that needs to be imposed, issues relating to counseling, and of course we would like to hear on the roles of parents out there in the community, because Rita, that is a very important aspect when we look at any legislation. It's the role of parents out there in the communities that is also going to be important. So we want to talk to them, to the parents who we're inviting in the public consultations, how we can work together in this area on the volatile substance abuse by our young people, because the law will be there, but it is how we, as our contribution as members of society, is very important in ensuring that the law is abided. That is why the role of the members of the public, and especially parents, is so important.
Okay. Dr. Karen, perhaps you could just talk about the whole counseling process. This is not just the child that's being counseled, or the parents and the family members, are they also involved in this process as well?
I think there's different types of counseling that's available depending on the child's need and what needs to be addressed. Then you can put a counseling package in place for that individual. So it's not a whole package that's going to be available for everyone every time they come in. So in some cases, you will need to get the family in. You will need to talk to the parents and educate them, or make them aware of their responsibilities in these things. Because the last thing you want to do is remove the child from their home and then there is no other support in place. So you need to get this parents or whoever the caregiver is to be able to counsel them as well on their roles and responsibilities, how they can seek help, and if they're noticing this sort of behavior in their child, what they can do to help their child, because they're the ones who are there 24 hours. It's not the counselor who's going to be there.
Okay. Mr. Ndrimbalava, perhaps you could just talk about the work that the council is doing within the schools with its partners in trying to get this message across, particularly to students and teachers.
Yes, thank you, Rita. As I mentioned earlier, one of our functions or one of our roles is the dissemination of information relating to drugs and substance abuse. We have materials, we call them IEC materials, or information, education, communication materials, that we do print out. There are some that are specifically relating to inhalants or solvents. And we have them in our office, and we have been distributing them to all the schools in the country. We have just completed the International Day Against Drug Abuse in June, and we have distributed quite a lot of materials. We have also been conducting training of trainers for teachers to make teachers aware on these various drug and substances that students are accessible to, and to enable them to communicate this effectively to students, to talk about the harmful effects. We also have been conducting peer education training, Rita. These are students that are chosen from the schools, the prefects, who have leadership qualities, and we use these students to communicate to the peers in the schools, because we have found that this method of transmission of information is very effective, because research has found that young people communicate best with other young people. Mm-hmm. So that is why we've been using this strategy of educating peer educators in schools. Mm-hmm. And of course, general awareness has been on an ongoing process over the years. We go out to the villages, to the communities, or any other organization that invite us to come and conduct awareness programs.
Mm-hmm. And this peer education program has been rolled out in all the schools?
This peer education program, unfortunately, Rita, at the moment is limited to a number of schools, about 20 to 30 schools. We will be expanding this next year. These are the schools that we have found to have a high number of cases of various offenses. So we do a targeted approach by dealing with these schools first. And just last fortnight, we have had a meeting with teachers from the Suva and Nausori schools, head teachers of primary and secondary schools, and we'll be talking more on how we are going to address these issues with them and the parents in the localities. And also, together with this, there will be a training on basic counseling skills. We are planning on that right now. And we will be informing the teachers as to when this program will be conducted.
Thank you. We'll take a short break and we'll be back in a moment. Welcome back to Speak Your Mind on Gold FM and FBC TV. I'm Rita Narayan, and in studio once again our guests are Mr. Masele Ndrimbalava, the Director of the National Substance Abuse Advisory Council, and Dr. Nirvana Karan of the St. Giles Hospital. And while we went on to that break, Mr. Ndrimbalava, we had a caller, Vilikesa from Lambasa. He was asking whether the draft would be available on your website, or where can people access it to have a look at what they can, study before they probably show up at these consultations?
Thank you, Rita. We are working on that, and I think it will be put into the Ministry of Education website either today or tomorrow or even Monday, and people can access that from the website. We are also working with the government ITC, the possibility of this document, if it can be in the government website. But actually the work is already begun. We have made consultation, and it should be out shortly in the Ministry of Education website.
Mm-hmm. Now, there is a sense of urgency in, as far as the council is concerned, in getting this draft decree endorsed by by government. That's the sense that we're getting.
That is true, Rita. Although we are mindful that there are issues that still needs to be sorted out, but we believe that if we have this decree put in place, then at least there will be some control on the sales of these substances to our children. Yes, there is indeed a sense of agency. And we have set ourselves some timeline towards the end of this year to have a final draft before we submit to government for consideration and for their decision.
Mm-hmm. Okay. Now we're in this final segment of this program. Dr. Curran, is there any message that you have for our listeners and our viewers?
I think in regards to the substance abuse, for this group, for the school students, I think parents need to be more aware and more active in their role as guardians, because sometimes these things, this abuse happens over a period of time, and it's allowed to go on without anyone picking it up until it's come to a stage where this child is not performing well, not wanting to go to school, and has other medical or mental health complications. I think the message should be to be more aware and to be more active in their role as parents and child caring for a child, that they should be doing all these things. And then that they should be, I just want them to know that there are services available all over the country. There's Empower Pacific, which offers counselling services. Some schools have counsellors as well within their own system. And there's, of course, the different stress management units all over the country at the divisional hospitals like Lotoka, Lambasa, and CWM. And there's, of course, St. Giles Hospital that you can contact and get information from. So where is the right place for you to go for your child who's having this problem, or who you can contact, and what is the best available options for you? We find that people are not taking that step, that they see these problems, but they don't come to the hospital, or they don't call us, or they don't use these other services that are available until it's too late and the child has done something in school, and it's the school that's bringing the child for help.
Mm-hmm. And there's nothing to be ashamed about to seek help.
Definitely, there's nothing to be ashamed about. I think it's more, it borders on neglect if you're not seeking help, and if you're not helping someone who's having this problem, because often when someone is abusing their substances, they're not able to ask for help themselves because of the intoxication or the state of mind they're in and things. And so it's very important for parents or other peers or the school to recognize this and then ask for help. There's no shame in it. And then it's not only St. Giles Hospital. We've got the centres at the divisional hospitals. You've got Empower Pacific with offices all over the country. So there's no shame in asking for help, because now it's more accessible, these services.
Mm-hmm. Mr. Ndrumbalavu, your final comments to the listeners and viewers.
Yes,
you have the public consultations coming up.
Yes, I think really the only message I want to put across is we inviting members of the public to come in numbers to this public consultation and provide their comments, their views, so that we can improve on this draft. And I would just like to emphasize again on the need for all the various stakeholders, for all of us to work together. We have the retailers association, we have the parents, and we have other members of the civil societies organization, for example, Empower Pacific out there, and we all need to work together in the implementation of this decree when it comes out towards the end of the year. But of course, the foundation, Rita, as I see it, is back there in the family, because that's the foundation of a society, and the parents need to take more active role in their child rearing in their homes, looking after the children, supervising them, making sure that there is a set timetable for children when they come back from schools, and knowing their children's friends, because bad company can corrupt the character of a young child. So therefore, the role of the parent is so critical in the supervision and also ensuring that this practice of abusing of volatile substances is not does not continue. Thank you.
Naka. Thank you very much, Mr. Jumbalawu and Dr. Karan, for joining us in the studio for this it's a very important issue on dealing with children and also substance abuse, particularly this category called volatile substances. Now we've come to the end of this program on Speak Your Mind, and you can join me again next week. I'm Rita Naran. Goodbye.